Thank you for reminding me that.
Okay, you're good now.
All right, well, good afternoon, everybody. And thank you again for having us this afternoon, Kat. And yeah, like you were just mentioning, by all means, feel free to, either raise your hand or feel free to interrupt if you want me to clarify something. There's no doubt about Medicare being, a little bit complex and complicated, but we are here to help. So the main reason we're all here, and by the way, my name's Stephen Rubacaba. I work with the nonprofit organization called SourceWise. I've actually been with this organization, over 10 years now. So I'm delighted to inform and educate you all about some of the changes that are coming about with the open enrollment period. So right now we're in the annual enrollment period for Medicare, comes every year. And this is an opportunity where we can make some changes to our Medicare benefits. So I'm going to talk about all of what the annual enrollment period is, what we can do as far as how we can exercise our rights, and utilize this period every year if we want to. So yes, and like Kat was mentioning, some materials we'll be sending you is going to be the slide deck or PowerPoint slide deck we're all reviewing here today. All of the website links will be built in, so you can certainly click on them. You don't have to write anything down. All of our contact information is definitely going to be there as well. So let's go ahead and get started. And I'll try to keep this presentation. I mean, I know it's Friday afternoon. I know everybody has things we have to do. So I'll try to keep it clear, concise as possible. And again, feel free to interrupt me at any time. And also, like Kat was saying, we will carve out, after I'm done with the presentation, y'all can ask me any questions you want. It'll be like an open Q&A forum. So let's go ahead and get started. So again, the organization I'm with is called SourceWise. We've been around in the community since the 70s, 1973. We were known as Council on Aging for decades. The main goal is to provide services for the elderly or senior services, although we've expanded those efforts to try and help and provide services for any aging adult 18 and up. So we had to change the name, and we are now known as SourceWise. And some in-house programs I'll briefly mention. We have an information and awareness team. And by the way, so SourceWise is the county's area agency on aging. So if it's any type of elderly senior service, if we don't have it in-house, we can certainly refer you to our partners within the county and community. But anyhow, so we do have an information and awareness team where their main function and goal is to know of all types of resources in our county. Now, I don't know about you, but from time to time, we need a lot of help from various places, and we don't know where to start. So the information team is the number I personally give to people I know in my own life. Sometimes we need help paying a bill. Sometimes we may need some funds for food. Sometimes we might need some equipment to help us move around the house. So this is a good place to start. Very friendly and very helpful. We also have our care management team, which they're essentially caseworkers or social workers. They're there to manage folks' care. And it's essentially for folks that are Medi-Cal eligible. So some people, they don't have advocates like family or friends on their side, and they don't know what programs they may be eligible for. So our case managers are a solution to that. So they're essentially there to help folks that don't really have anybody. So the care management team is a great resource for folks that are Medi-Cal eligible, and it's for ages 55 and up. We also have a senior employment program where their main goal is to get folks back into the workforce if they're interested. So they provide paid training to try to usher folks that are aged 55 and up back into the workforce, whether it be on a part-time or full-time level. It's a great program. They have a handful of different programs that they educate, retrain us to get us back in the workforce. Maybe we need some computer training. Maybe there's a specific field that somebody kind of wants to get in. So they're there to help get folks back and active in the community. We also have a Meals on Wheels program for folks that are bedbound. We can send them a weekly supply of meals with the senior diet in mind. So that will, I think the weekly deliveries typically arrive on Mondays, and it's a weekly supply. It doesn't cost a thing. They do ask for donations for folks that are able to provide it, but they never turn anybody down if you can't. And then finally, we have the Health Insurance Counseling and Advocacy Program, and that's the program I'm working with, and that's who, and I'll be talking about HICAP all throughout this presentation. So one of the functions of HICAPs across the state are, we give free, objective, and unbiased Medicare counseling. So we're not insurance agents representing any insurance company or any insurance person. We don't care about any of that nonsense. Our main goal is to provide you with some information about your Medicare options. We're going to give you every single one of them. And then we just give you some education so you can make an informed decision on something as important as your healthcare. So HICAP is what we're known as statewide in California. We're a part of a larger federal group called the State Health Insurance Assistance Program, or SHIP, and it's managed by the Center for Medicare and Medicaid Services. So you can find us all across the country. And here's some information on how to get a hold of us. Now, typically we're stationed at senior centers, public libraries, health centers, all throughout the county, providing outreach, kind of like this, only, we used to do it in person for obvious reasons. We haven't really been able to get out in person as much as we all want to quite yet. But soon enough, we are opening up our face-to-face counseling at some of these facilities. But if you ever need an appointment to get a hold of us, you have basic Medicare questions, you have complex Medicare questions, before you speak with an agent, by all means, feel free to give us a holler. Numbers here above. And again, it's going to be on on all the materials that we'll send out to you. So let's see. Let's go ahead and get into it. Now, the reason we're all here, and by the way, I know there may be people here that are brand new to Medicare. Good. I'm glad you made it, because the information we're going to be giving is relevant to you as well. And right now we're in the middle of what's called the annual or open enrollment period. So nationwide, between October 15 and December 7, anyone with Medicare can make changes to their Medicare. Now, before I started working here, I used to think that, oh, Medicare, everything's going to be taken care of. I may not have to pay much. I may not have to pay anything. I've worked enough in my life. I've contributed to Medicare. Everything's all good. But no. We have decisions to make. Stuff costs money. And we can make changes every year. So, don't be afraid when you first enroll, because we can make changes every year during this open enrollment period. So right now, folks with Medicare can add, drop, or change a Part D prescription drug plan. You can change your Part C or Medicare Advantage plan. Some folks, so the main reason for open enrollment is to change how you have your medications filled. A lot of it is that, or you can change your Medicare Advantage plan, or some folks want to leave their Medicare Advantage plan. And I'll talk about what a Medicare Advantage plan is a little bit more shortly. But some folks can leave that Medicare Advantage plan or HMO model and go back to original Medicare, where you can kind of go anywhere you want to in the country. But we just got to make sure that we protect ourselves and make sure we have a Medigap or a supplemental plan. And again, I'm going to get more, I'll talk more about that before we dive into this stuff. And again, for those of you here today that are currently on Medicare, you're going to hear me mentioning this document called Annual Notice of Change. This document is sent to every Medicare beneficiary every year. Typically, it's around September. And what this does is it's going to tell you, okay, Steve, here's what we covered in 2021, right? Here's how much some stuff cost. And then it's going to show me side by side some changes. So if they're going to raise premiums, if they're going to no longer cover a benefit, if they're going to change tiers for a specific medication, they're going to put it side by side for me to let me know. And then I can think about that and decide if I may want to change, if there may be something better. Maybe not necessarily better, but more affordable with the same coverage, right? Or more coverage. So it's important to review your annual notice of change, or ANOC. And I know there's a ton of acronyms that we hear thrown around nowadays, but that's kind of what Medicare refers to it as, and that's what I'll try to refer to it as moving forward. So take notes of these changes, review your annual notice of change. You know, if you're getting mail from Medicare, Social Security, you know, some type of government official entity, you know, make sure you open it and read it. Don't be like me and let some mail pile up on your your dining table and not opening it in a timely fashion, because it may be very important. So review your annual notices of change. They're going to arrive every September. Okay. So before we get more into annual enrollment period, what you can do, what the updates are for next year, I just kind of want to give a real quick review of Medicare. What are the parts of Medicare? Because sometimes we need reminders, okay? So the first piece of Medicare that we all may be familiar with is the red, white, and blue Medicare card, which is kind of called original or traditional Medicare, or fee-for-service Medicare. This is how it was created back in 1965. They had Part A, they had Part B, like boy. The card nowadays looks like this red, white, and blue card. So Part A, and by the way, these services here that we're looking at, typically original Medicare only pays 80% of these services. The remaining 20% of all of these costs is put on to us, the beneficiary, okay? So Part A insurance is called our hospital. That's what covers our hospital coverage. So if we get hospitalized for whatever reason, that's paid for by the Part A component. Maybe we need some skilled nursing care, hospice care, all covered by the Part A mechanism of our Medicare. But a lot of us go, you know, we seek doctor visits, you know, maybe we're not feeling all that good. We need some lab work, blood work. Maybe we need some durable medical equipment like a wheelchair, some type of equipment to help us get around the home. That's all covered by what we call Part B, the outpatient type of mechanism of it, okay? And that is, again, some of the main parts of Medicare. Now, another option, you heard me mention it earlier. And by the way, so this first component of original Medicare, or fee for service, there's not necessarily a network for that. So the beauty of that model is you can go anywhere you want in the country as long as they take Medicare assignment. The network is huge. So you don't have to stay within any type of network. You can go see a doctor or a specialist anywhere in the country. You don't need to get approval, make an appointment, and you can go. Alternatively, we have what's called a Medicare Advantage, or capitated, or capitation route. And by the way, original Medicare, whenever we seek a service, we have to pay a bill. So we get a fee for the service. Medicare pays 80%. Typically, we pay the remainder, but usually folks pick up a Medigap to help us with those out-of-pocket costs. But I'll talk about that. So it's a fee for service. Medicare's not going to get a bill. I won't get a bill unless I seek a service, right? Medicare Advantage, on the other hand, it's kind of like a privatized model. So it's written into law as Part C, like Charlie. So what Medicare does is they assign our Part A and B benefits, our hospital, our outpatient care, and it assigns all of that to these Medicare Advantage plans. Most of those plans or models are like an HMO model, health maintenance organization. Basically means we got to stay in their network. So what Medicare then does is they pay these Medicare Advantage plans a specific set amount of money every month. So for every member that joins Medicare Advantage, the federal government pays them roughly about $1,000 a month for them to manage my care, or manage your care, right? So regardless if I go see the doctor once a month or 10 times a month, the federal government gives them that $1,000, and then they have to manage my care with that money. So that's why that's why they limit the networks, have a specific set amount of doctors, to kind of be able to control the costs, right? So that's the alternative option. And next year, there's going to be a ridiculous amount of options for us. We're going to have 62 different Medicare Advantage plan options to choose from. Now, don't get me wrong. I think there's a beautiful thing about having options, but it can be rather complicated, to make these decisions. Now, there are 62 insurance plans that all want our business. They all want our money, and they all want us to join them. So one thing that makes it easy is that they include the prescription medications. Now, I didn't share this with you, but original Medicare Part A and B.
You're going in and out. Could you keep your face straight? Your voice comes in and out.
Yeah, definitely. Let me know. I'm not changing anything, so let me know if the sound drops in and out, and then I'll address the microphone and maybe change mics. Okay, thank you for that. So let's go ahead and see if I can get back in. So the alternative option are these Medicare Advantage plans, but it's kind of like a one-stop shop. They include our prescription medications. We don't have to shop around for a Medigap plan or a standalone prescription drug plan. So makes it very attractive to folks. And not only that, they add on some extra benefits. They're able to add in extra benefits like maybe preventative dental care, vision. Some of them offer monthly stipends of over-the-counter drugs or medications, cough drops, cough syrup, these types of things. Some of them even provide transportation, maybe to and from your medical appointments. They allot a specific set number of transportation trips. So they do have these extra benefits that, again, are awful enticing to folks. Now, just to let you know, regardless of which option we choose, original Medicare or Medicare Advantage, we all have to pay something, right? Now, these Medicare Advantage plans, they could even have their own monthly premium. Some have a monthly premium of $0, which again is very attractive. Everybody on Medicare must pay for our Part B, like boy, monthly premium. There's no way around it. We have to pay this some way or another. And these numbers that we're looking at here, this is the monthly premium structure or fee structure for 2021. For 2022, the federal government hasn't released them yet, but that's no surprise. They typically release this information around early to mid-November. There have been some projections of what these costs will be. It's estimated that next year's Part B monthly premium is going to be around $158. So it's going to increase roughly $10. And we pay this amount based on our income. So the base rate for the premium is $148.50. If we file with the IRS our taxes as single, our yearly income has to be less than $88,000 or less, then that's what we're going to pay. If we're filing married or as a joint couple, then the yearly income is $176,000 or less. That's what we're going to be expected to pay every month. Now, for higher income earners, here are some brackets here. They have to pay an income-related monthly adjustment, or IRMA. But what that basically is an additional tax. So everybody's got to pay the $148.50. If for the higher income earners, they tack on this additional amount of $59.40. And you can see as the income levels increase, that IRMA also increases, okay? Now, on the other hand, for folks that are on the lower end of the income or resource spectrum, there's a lot of programs out there that help absorb those costs. Now, a lot of folks, they can't afford the Part B, like boy premium, right? These programs can help absorb that. Now, these are all based on income. So if we are between 100 to 135% of the federal poverty level, folks can be eligible for these programs. They're called Medicare savings programs. And they're a beautiful program that help out a lot of people. Now, if you think this may be something for you, or maybe you think, you know, you're a bit low on resources, give us a call. We know the income limit thresholds for these programs, and we can help you apply for these programs. So give us a call if you think this may apply to you. Maybe you know somebody, family, friend, whomever. You know, information is very helpful. If we know about it, we can take advantage of it, or not really take advantage of it, but utilize it. That's what it's there for, okay? So original Medicare, that's kind of how that works. Stuff can get pricey. We have Part B, like boy premiums, and there may be these out-of-pocket costs, these 20%, right? Now, I don't know about you, but 20% of a hospital bill, I don't want to know what that costs. More than likely, I can't afford it, which is why a lot of folks will protect themselves and pick up what's called a Medigap or supplemental plan.
Your audio keeps cutting in and out again, Stephen.
Here, let me try this. Let me go. Thank you. Let me just switch mics. Okay. Let's see if that is helpful. Let me just go ahead and stop this. And I'll start from the top. Sorry about this, everybody. Let me see if I can get this going.
Thank you for being patient with us, everyone.
Kat, this is Jerry.
Yes.
Thank
Hi,
you for
Jerry.
doing this. We appreciate it very much. And Steve.
Yeah, our pleasure. Yeah, we like to do this every year. I know Stephen was here doing this last year, but I don't think he was the one presenting last year. So I think this might be
Probably myself.
yeah, I think that's what his name was.
Okay, so I'm going to try a bit more of an analog type of microphone here.
Okay.
Does that sound a little bit better? But I have heard feedback that this one, the volume kind of tunes lower. And I don't know if it's just because it's an outdated mic, but my new fancy mic is inconsistent, of course. So I'll try this again, and I'll see if, I don't know if speaking slowly may help, but by all means, please stop me if it's just too awful. I may be able to even try, actually, does this sound better, everybody?
For now, yeah, it sounds okay. It doesn't, it's not something we notice until you're in the thick of it.
So let's just, I'm just going to use my laptop microphone. I think it may be just more reliable with the volume. But again,
it's
yeah.
the position, it could be the position of your head in relation to the microphone. When you move your head, you move away from the mic. So if you've got maybe something like a Bluetooth or something that's attached to your ear and is always in front of your mouth, that would work. But you're moving your head, and that probably is what's making you go out.
I think that was what his last mic was a Bluetooth.
Yeah, my last mic was a Bluetooth that was literally like plugged into my head. So that one wasn't working. So we'll try the laptop microphone. It's literally like, I don't know, 8 inches from my face. So we'll go ahead and try this. And let me know if I'm shouting, but I can project my voice a little bit.
No, it's when you move your face.
Okay,
your head moves.
So I'll go ahead and try and stare straight, and then I'll do my best. So let's go ahead and try. We'll try it again.
Thank you,
and again,
Stephen.
just please stop me if the sound gets funky. I'll try and stay more still and project appropriately. All right, so let's go. So let's see, what did we talk about? Let me go back. And okay. So now we're going to dive in a little bit about Medigaps or supplemental policies. And these help pay these out-of-pocket costs. That's why they were created. They're all standardized, which is nice. So a Medigap plan A versus a plan B, plan D, they're all going to pay the same things. They're all going to cover our out-of-pocket costs the same, but they're different companies. They charge all different types of monthly premiums, and they're all over the place. So they're going to charge us different amounts of money. So again, the main purpose that these Medigaps were created is they help pay our Medicare Part A and B out-of-pocket deductibles, co-pays, co-insurance. They fill in those gaps. Now, again, they're all standardized. Now, please don't confuse a Medigap Plan A, Plan B, Plan D like drug with Medicare Part A, Part B, and Part C. I don't know who wrote the rules to these plans, but they definitely didn't make it easy for us to understand. I wish they would have named them something different. Plan 1, 2, 3, who knows? So anyways, yeah, please don't get those confused. And by the way, in order to purchase a Medigap or supplemental plan, you must have Part A and B, like boy, of original Medicare. Just like Medicare Advantage plans, if we want to sign up for a Medicare Advantage plan, which I'm going to talk about also, we must have original Medicare Part A and B, and they must be effective, okay? So one of the inserts or one of the Medicare materials that we're going to be sending out just after this meeting looks pretty much just like this. So if you look across the screen, a Medigap plan A, B, D, all the way down to C and F, if you see one of these little bullet points next to it, go all the way down to the left. This is the out-of-pocket cost that it's going to cover. So the more bullet points these plans have, the more robust they are, the more protection we have as far as our out-of-pocket costs. But typically, the more expensive these products are, right? And you may notice that the column and rows to the left, A, B, D, G, K, L, M, and N, these Medigap plans are available for everybody to purchase. But plans C and F, like Frank, they're only available to Medicare beneficiaries that were eligible for Medicare prior to 2020. And you can see they're the most robust plans that are offered. So what the federal government took off the table is the Part B like boy annual deductible. So moving forward, folks like me, I'm not eligible for Medicare quite yet. I'm going to have to pay out of my pocket this Medicare deductible, a couple $100, okay? But all the rest of the plans are available for us to purchase. And one thing, and by the way, the insert that I am going to be sending out to y'all, the Medigap pricing is kind of strange. Well, not really strange, but it's based on our zip code and it's based on our age. So the examples I gave or the examples you'll be getting are based on the zip code where my organization works. And then I put in some generic ages of age 65, 70, 75, 80, etc. So if you want your specific rates, looking at the form that I'm giving you is a good idea of what it's going to cost you, right? But for an exact quote, where I get those rates, by the way, to create this document is from this website here, which is insurance.ca.gov. It's a California website. You can search for the Medigap rates available to you, your specific age, and your specific zip code. And I would always contact the plan who's selling us those products to get an exact quote also, but the California website's pretty precise. So that's good. And let me see, what else did I want to share about Medigaps? I thought I had one other thing. Okay, so this. Okay, so thus far we've talked about original Medicare Parts A and B, and that typically covers 80% of our services and treatment. We also mentioned that Medigaps or supplemental plans, they help absorb some of those out-of-pocket costs, that 20%. So it's a good way to protect ourselves financially, okay? And now to make sure that we're fully covered. And by the way, we're still in the original Medicare model, the original Medicare world where you can essentially go anywhere in the country that takes Medicare assignment. The only thing we're missing at this point is our Part D, like drug, a prescription drug coverage. It's very wise to get this coverage, even if we're not taking any medications, and I'll go ahead and let you know why. For 2022, we're going to have 25 different standalone prescription drug plans that are available to all Santa Clara County residents. This year in 2021, there were 32 different options. So that market kind of shrank for us and it dropped us down to 25. Now, we can purchase a standalone drug plan if we have Part A or Part B or both. So we can have one and or the other. Now, like I was mentioning earlier, the Medicare Advantage plans, almost every single one of them includes our prescription medication coverage, all but two. There are two plans for next year that are not including our prescription medication coverage for some reason or another. Friendly reminder, in order to have a Medicare Advantage plan, you must be enrolled in Part A and B like boy. To give you an idea of some of the costs for next year, now these plans vary. They are as low as $7.50 for a monthly premium, all the way upwards to $160.20. That's just for the premium. We're not talking about our co-pays or co-insurance when we have to pick up our medications. The deductibles went up next year. Well, they're going up next year. So some of these plans can charge anywhere from $0 for the deductible upwards to $480 for that deductible. And again, they're kind of all over the place, these plans and what they're charging. The national base average, if you're curious, I'm always curious to look this up to see what folks are paying across the country. It's around $33. And that is what is used to calculate our late enrollment penalty. So if we don't enroll into a Part D like David or D like drug plan, you know, I've counseled folks where they tell me, well, you know, I'm fairly healthy. You know, they are new to Medicare. They sign up for Part A and B. They may sign up for a Medigap or supplemental plan, but they're not taking any medications. And you know, they go years without taking medication. So they never buy a Part D plan. Then all of a sudden, fast forward, you know, maybe a handful of years, they all of a sudden need some prescription meds. And then we have to sign them up. Well, we don't have to, but you know, they want to sign up for a Part D plan. They may get hit with what's called a late enrollment penalty. And they base that penalty on the national average. Some folks, it can be a trivial penalty. I think it's something like 10%. So it's not that expensive, but years and years and years of this can add up. This one man, again, he thought he was saving all this money for not signing up for Medicare. I think he went 10 years and then he needed it. And he had a late enrollment penalty for his Part D like David or D like drug medications. It was roughly $50, 50. And that was for the rest of his life that he had to pay this additional late enrollment penalty. So just be mindful. Whenever I counsel folks that are new to Medicare, they don't take any medications, I encourage them to sign up for a Part D plan, you know, the least expensive one, just so you have the coverage just in case. Nobody knows what's going to happen tomorrow, next month, next few months. We may need to take some prescriptions and we have the coverage. And this is another good reason now. Right now, during the annual enrollment period, everybody in original Medicare, I encourage every single person I talk to. A lot of our certified counselors with HICAP, a lot of my colleagues, they're Medicare beneficiaries, and they don't just talk about doing plan comparisons to people. They do them every year because they know that it's beneficial for them to just do a simple plan comparison. They can save money. So they review their annual notice of change every time they get it. And again, it's very beneficial to review your annual notice of change, to take note of the changes. Maybe they're raising your premiums. Maybe a colleague of mine, they were lowering his premiums. but they were jacking up the rates for his co-pays. So at first glance, he's like, oh, great, I'm going to stay with them. But then as he looked closer at his annual notice of change, he understood that overall, it's going to cost more for next year. He did a plan comparison, signed up for another Part D drug plan that's going to take effect January 1 of next year. So whenever we make changes to our Medicare during the open enrollment period, it becomes effective January 1. So it becomes effective January 1 to use for the remainder, for the entire calendar year, okay? Now, what we do and what we encourage folks to do whenever we do a, excuse me, a Part D plan comparison, we don't look through the Part D comparison file or insert that you're all going to get. And by the way, I'm going to send you the costs for all of the Part D drug plans that are available to us in our county. But it doesn't have every single medication and what the copays are. Everybody's different. We take different meds and they all have different copays. So what we do is we compare those plans using Medicare's Plan Finder tool. It's fantastic. I mean, I encourage everybody to create a My Medicare or Medicare.gov account. You can truly take control of your Medicare. You enter in your prescription medications and then they're fully trackable. It gets updated whenever you get new prescriptions filled. You can do your plan comparisons like that every year. It doesn't take much time or energy. It is going to take a little time or energy in the beginning just to create your account, but it's pretty easy. But for folks that have a lot of medications, and I've counseled folks, they have upwards to 20 plus prescription medications. We sit and enter them all in, enter in the dosage, enter in the quantities, and then we compare every single plan and what it's going to cost for next year. So what we encourage folks to do, and by the way, what we do, and we offer one-on-one counseling all year round. Right now, most of the counseling is over the phone or it's in a virtual environment, kind of like you're seeing right now. We can show people our screens, we can show folks what we're doing, but we do this all the time. I'm always doing Part D plan comparisons for folks because they get a bit intimidated by the website, and then I try to empower them to get comfortable with the website. After a year or two, they're doing it on their own. They're helping their own friends and family. So I would encourage you, create an account if you can. If not, you can just enter in your meds kind of in a generic fashion and compare them that way. But if you do it again next year, you're going to have to re-enter in everything. So see if you can create an account for yourself. It's a fantastic tool. The federal government is revamping and improving this tool every year. And I'm very happy to see the improvements. There's no nonsense in the Plan Finder tool. It's not so busy on our eyes. It's rather intuitive. So I like that they've been fixing it up once they completely revamped it at the end of 2019. Now, similar to the Part B IRMA or adjusted amount that we may pay. So there's no additional tax for folks that fall within these tax brackets, or if we earn an annual income of these amounts, then we don't have to pay anything in addition to the monthly premium. But for higher earners, they do have this this added tax that they would have to pay the federal government. So same thing, on the other hand, for folks that are lower on resources and or income, there's a program that can help absorb a lot of these prescription drug medication out-of-pocket costs. I actually stuck in some income limits here. So it is based on income and assets. So, roughly here are some numbers for 2021. 2022 numbers haven't been released. But this number is due to go up with inflation and everything else and cost of living. So these numbers more than likely are going to rise. I just have no clue how much they may rise. Okay. But if you think this may apply to you, your family, your friend, reach out and give us a call. We can see if you're eligible and we can help you apply. for this low-income subsidy program. It's also known as extra help, okay? So I covered a lot of bases about original Medicare, the components of original Medicare, what we can and cannot change within original Medicare. So now let's talk about the completely other model, which is called the Medicare Advantage or Part C plans. So again, this is kind of like a one-stop shop, which is, again, very attractive to people. It can be a lot of work shopping around for a Medigap plan. Maybe it can just be unaffordable for some folks. It can be a lot of work shopping around for a Part D drug plan. So a lot of folks just join a Medicare Advantage plan, one-stop shop. Everything for the most part is included. But we just want to make sure that the most important thing folks I notice have are, can I see my current doctors? You know, if you're going to see specialists, are my specialists in these networks? And sometimes they're not. So some folks have a main doctor that they see, they have a specialist or two that they see, and they're in 3 different Medicare Advantage plans. So that may not work for them. There may be a Medicare Advantage plan where all of the folks that they prefer to see are there. So they want to join that route. But sometimes original Medicare works for folks. Again, it's mainly due to flexibility. So next year, you know, we do have 62 different Medicare Advantage plans to choose from. It's up from 55 last year. 2019, there were only 43. So at the moment, more than half of Americans on Medicare are in the original Medicare route. But there's a lot of folks that are still in the Part C or Medicare Advantage route for various reasons. Now, with the open enrollment, what we're in right now, we have the opportunity to change our Medicare Advantage plans if we want. So, you know, one well-known Medicare Advantage plan here on the West Coast, and I was born and raised out here, so I'm very familiar with Kaiser Permanente. There's Kaiser is offering 2 senior Medicare Advantage plans, and they make it very easy for folks to join in and slide into that network. But if that network isn't working for you, you can certainly change and shop around for any of the other 61 Medicare Advantage plans that are going to be here next year. This is also an opportunity for folks that want to maybe leave their Medicare Advantage plan and go back to original Medicare. Now, let me share something. It's always easy to leave original Medicare and join a Medicare Advantage plan. No problem. There's no medical underwriting, no health-related questions. They can't deny you a Medicare Advantage plan if you have pre-existing conditions. It's no problem. It can be a little bit tricky going from a Medicare Advantage plan back to original Medicare. One reason is because these Medigaps or supplemental plans, they may be allowed to ask us health-related questions, and they can use medical underwriting to determine if they want to sell me a Medigap plan. Based on that, they can deny me. And then, you know, I may not be able to find a Medigap or supplemental plan. So it may be very tricky to get out of a Medicare Advantage plan. But every year in California, we have an added protection. It's called the guaranteed issue right, where what that means, and by the way, there are 36 Medicare Advantage plans that made changes for 2022 that trigger this guaranteed issue right. So what is a guaranteed issue right? I put the code, the law as it's written up here above. Now, what it means is that if my Medicare Advantage plan, if they increase certain rates by 15%, maybe they raise my premiums, maybe they raise some copays. If they reduce or take away any benefit, if they terminate a relationship, maybe with the doctors I'm used to going to, with the medical groups or hospitals I'm used to going to, just like that, I can get out of that Medicare Advantage plan using this guaranteed issue right and buy a Medigap or supplemental plan. And guess what? These Medigap or supplemental plans, they are not allowed to ask me any health-related questions. They can't ask any medical underwriting. But let me tell you, and we help folks do this all the time too. So a lot of the times when we counsel folks, you know, they're like, oh, okay, I'm going to call this Medigap plan and do it on my own. This is good. A lot of the times it may be somebody who doesn't even work in California. They may work in some random state. They're not familiar with this California rule or law. Maybe they do live in California, but they're just not up to date on all the most recent laws and codes. So they may have to take pause, ask their supervisor, but whatever you do, don't answer any medical health related questions because you don't have to. By law, they're not allowed to ask that. You can cite this code. They can go talk to their supervisor if they wish. You can get a hold of us. We can advocate on behalf of you with that phone call, and we can help you out. So I'm also going to include now, every year there's usually folks who want to go back to original Medicare, but they have some pre-existing conditions and they know they're going to get denied unless they leverage this guaranteed issue right. One of the inserts I'm going to send you, it's going to list all of these 36 Medicare Advantage plan companies. We let you know what they did that triggers the guaranteed issue, and basically that you can exercise it. So check it out if this is something may interest you, if this is something that may interest you. If you do want to do it on your own when you're applying for that Medigap or supplemental plan, cite this code. You can certainly, again, have us on that telephone call with you to make sure that we can help you through that process. So again, the Medicare Advantage plans, for those of you that are signed up for those, you would have received your annual notice of change. It's going to show you side by side, hey, Steve, I'm sorry, but we had to take away this benefit, or hey, we had to raise some copays for you. Here are the changes side by side. So please take note of those annual notices of change and see if it's worth your while to make a change to your Medicare benefits for the following year. Now, I just wanted to include also in the resources some go-tos that I'm always citing, I'm always reviewing. Medicare.gov is an excellent source for resources, what open enrollment is, what you can do. So I did provide a bunch of links, and I just wanted to remind folks during, well, this is all year round, but especially during the open enrollment period. I don't know if you noticed, but I see tons of commercials on the television. There's all kinds of ads online trying to get me to buy, you know, various Part D drug plans, Medicare Advantage plans. Last year, I remember seeing Joe Namath on the commercials a lot, trying to sell people Medicare Advantage plans. You know, just be mindful of some of these fraudsters. Guard your Medicare number. Medicare, Social Security, they don't call you asking for your Medicare number. They know it. Those institutions typically put things in writing. They'll mail it to you. Be mindful of free genetic testing scams. Believe it or not, there's still COVID scams. You know, they're very much rampant over the phone. Check if you do create a Medicare.gov account. It has every appointment and treatment that you have. It shows everything that Medicare was billed for. If you see some funky bill by some doctor you know nothing about in some state you've never been to, call Medicare and let them know. Check those statements for accuracy, pretty please. HICAP does have a senior Medicare patrol, which acts as a liaison for Medicare beneficiaries like yourself and law enforcement. Now, there's an estimated amount, I think this year was over $50 billion in Medicare fraud, waste, and abuse. Now, let me tell you, we all pay into this program. So, you know, the goal is to prevent fraud. You know, we want to make sure we are paying attention to detect it and then report it if you have to. because there's a lot of unnecessary fraud that goes into this. So just a friendly reminder. And I think, now is a good time for me to just remind y'all how to get a hold of us. And there's all kinds of ways to get a hold of our organization now. If you or maybe somebody that you know resides in another county, there's a toll-free number that will automatically route you to your local HICAP office. For folks that are out of state, you can find your local SHIP office by going to medicare.gov/contacts. We're always here to help, so please don't hesitate and reach out. You got any questions? I'd like to thank you all for being here today. Thank you for being patient with me and my microphone volume nonsense. Thank you again. I hope the rest of it was decent as far as volume control. I hope you learned something new today. Now is a good time to open it up for any questions that y'all may have. Feel free to voice the questions yourself. Let me see if I can peek over here. I'm gonna have to look on my other screen here. Let me see if I can pull this here. So I'll try to, in the meantime, I'll try to review the questions. Let me try to scroll all the way back, but now's a good time to voice your own question if you want while I start sorting through this. Somebody asked, how can I get a hard copy of the SourceWise Medicare Consumer Guide?
You
Email
normally
me.
send that out, don't you?
Yeah, no, I'm mailing out hard copies of the consumer guide actually quite often. So nowadays, I'm working from my office pretty much 5 days a week. So, and even before I was working out of my office 5 days a week, we were typically doing mailings around once a week. But Mabel, I can certainly send you a hard copy. Me a favor, you could either call, email me directly at this. I'm going to put my direct email address and telephone number here in the chat. So feel free to reach out to me if that's okay, Mabel. I'll definitely send you a hard copy, no doubt about it.
And then Roy has his hand up. Go ahead, Roy.
Yeah.
Yeah, question, well, comment. You mentioned that the Medigap premiums were dependent upon age and zip code.
Yeah, they have 3 different categories.
Yeah, well, let me just make a comment on that.
Sure.
I live in zip code 94303, which spans 2 counties, Santa Clara and San Mateo. And in a previous time, the rates for San Mateo County and Santa Clara County were different, significantly different for the premiums. So people might want to make sure that, and the Santa Clara County premium was much less.
Oh.
So that's my comment.
Well, you know what? That's good to know. I should probably take better note of what zip codes are on the cusp of more than one county. Because yeah, no, that's a great point. Thank you for sharing that. I appreciate it. That was great.
Let's see, there's a Medicare Advantage plan that has a PPO plan. How is that different from Medigap that people can see any doctors and specialists anywhere in the US as long as they take Medicare without primary physician's referral?
Yeah, so the PPO plans, actually, it's kind of a rarity. So I know this year, I believe there was only 1 PPO plan available. Next year, I think there are 2. So not too much of a difference, to be honest. It's just the funding and the costs. So yeah, so there are a lot of folks that are interested in Medicare Advantage PPO plans. And a lot of them, they include these extra benefits. Now, I also know for next year, I know there's 1 PPO plan that doesn't have a Part D prescription drug medication included. So something to take note of if we are choosing a PPO option or PPO plan. That's a great question because yeah, they are very similar. MA plan. And let me see if I think I could take this next one. If you if you leave Medicare Advantage plan, can you go back without underwriting? So let me also share with you one other opportunity that we have. So within Medicare, we are allowed to try out a Medicare Advantage plan for 12 months. It's called a test trial run of sorts. If we're not interested in that Medicare Advantage plan, we can opt back for original Medicare, no questions asked. We're only allowed to do that one time. That's one protection against medical underwriting. The other one that I know of in California is that, well, when we're first eligible for Medicare, when we first turn 65, we can buy a Medigap, no questions asked, as long as we buy it within a specific window. No health-related questions. So when we're first eligible, no medical underwriting for Medigap. And if we test out a Medicare Advantage plan for the first time for 12 months, we can leave it, go back to original Medicare, no questions asked for Medigap. And then finally, the guaranteed issue rights that we have here in California. And that 12-month rule is also a California protection, by the way. So those are the only few times that I know about where we can exercise, or maybe not exercise, but not be asked health-related questions. And this is a good question. I'm glad this one came up, Carol. I am still working and covered by my employer plan, by my group health plan. I was told I do not need to apply for Medicare until I stop working. Is this correct? The answer is yes. There's a lot of folks that turn age 65, which is when we're all first eligible for Medicare, but we're covered by a group health plan. A lot of folks delay their enrollment, right? Because like I was saying earlier, well, I didn't say this earlier, but for Part A, most folks have contributed into the Medicare program. They don't have to pay anything for Part A. But I did say everybody got to pay for Part B, like boy. So folks who are covered through a group health plan for either themselves, right? Because maybe they're still working, covered through their job, or if they're covered through their spouse's group health plan, they can delay their Medicare enrollment. They will then be in what's called a special enrollment period. So you could extend that. So as long as you're covered by a group health plan, you don't need to take any action. I would encourage you, once you know when you're going to retire, when you stop working or you stop being covered by your group health plan, whatever one comes first, give us a call because we can go through your options because you're essentially kind of new to Medicare. So, you know, I encourage everybody who's kind of new to give us a call so we can sort through your options. But no, yeah, you would definitely be able to delay your enrollment. Let me see here.
Adrian has their hand up. Go ahead,
Yeah,
Adrian.
Yeah, please go ahead and voice it. I want to hear someone else's voice instead of mine.
Thank you. Yeah, I have a question. My wife is going on Medicare November 1, which is Monday, and she uses a continuous glucose monitor. So she has sensors that she puts on her arm and then can read her glucose on her phone. So I've been getting a lot of conflicting advice as to how it's covered or not covered under Medicare. A lot of people say it's covered under Part B as a durable medical equipment, DME, and that Medicare has rules that, you know, standards on when they will pay for it, like whether you're getting insulin and how much or not. And then other people say, yeah, but it's been waived this year because of COVID. And then I was at Walgreens and the pharmacist said, you know, sometimes it's covered under Part D in a drug plan. And they've been able to get some drug plans to cover that for their patients. But when I go to mymedicare.gov, you're not allowed to put in a continuous glucose monitor. My wife uses the Freestyle Libre 14-day. It's not there, so you can't put it in to check whether a Part D plan that they have listed on mymedicare.gov has that on their formulary or not. So What has been your experience, or what advice do you have for trying to figure this out?
Well, here's my experience with diabetes medications. It's all over the place and it's very complicated. That you are right. Certain hardware or equipment is covered under durable medical equipment, and the definition is, it's got to be more than just kind of like a one-time use type of thing. So it's so strange. And with diabetes medications, the pharmaceutical industry has such a handle on it. I mean, the prices are all over the place. The tiers are constantly shifting. COVID threw new things in the mix. There are certain Medicare Advantage plans that are offering specific diabetes medications for ridiculously low prices, but it's specific meds. So it is rather tricky to kind of know, okay, what is covered for you and your medications? What I would ask for you to do, Adrian, is give me a call. I don't know if you spotted my phone number inside there, but my direct phone, it sounds like you need an appointment, so we can sit down and chat with you, to be honest. So if you want an appointment, I mean, something like this is not easy. It's not easy to answer. We would have to kind of dig through it with you. And we have folks that specialize in prescription medications, durable medical equipment. Which one is it? So we have folks that have certain specialties that as far as counseling, even folks that are Medicare, Medi-Cal eligible, those are extremely complex. They are coordinated, but again, we have counselors that specialize in that. If you, Adrian, please write my phone number down. My direct number is 408-350-3281. You'll get me directly. And we should definitely get an appointment in the books, especially since her Medicare is starting November 1. I'm assuming that her Part A and B, like boy, is going to be effective November 1. I don't know if you have signed up for either Medicare Advantage or Medigap plan, but we can certainly sift through it with you. And I would definitely want you to review, Adrian, the Medicare consumer guide you'll be getting within an hour or so. It has some basic costs of these things, so at least you can get an idea. But real quick before, if you don't mind, when did your wife turn 65? If that's okay that I ask.
Sorry, I was unmuted. She turned 65 on November 22nd.
Okay.
So
So the good news is that she still has time. I mean, she's in her initial enrollment period.
Okay.
Actually, I have a slide for this, just in case. So she still has 3 months to sign up to complete her Medicare enrollment. I'm glad she signed up for Part A and B. The clock does start ticking as far as Part D, like drug and Medigaps, but definitely give me a holler. You can call me as soon as you hang up. It's probably going to dump you in my voicemail, but I'll go ahead and give you a call back. We'll get something in the books. This is important. And diabetes, I mean, my goodness, yeah, they're all over the place. And by the way, this little initial enrollment period slide is going to be in the slide deck I'm sending y'all. There's always somebody who's new to Medicare that joins these. So thank you for asking that, Adrian. And again, it's hard to sift through this stuff yourself, or even with Medicare alone, especially when states have different rules. Products are different from county to county. But yeah, definitely give us a holler and reach out, and we'll definitely help y'all sort through it. Even if we have to call Medicare, even if we have to call these Medigap plans, Part D drug plans. Again, we are your advocates. And let me see. I don't know. Did I answer that question, Adrian? I mean, I know I didn't really answer it, but the answer is give me a call. Let's get you an appointment so we can really get an answer for you.
Yeah, I think that's all you can do right now, actually.
Yeah, I mean, last thing I want to do is misinform anybody. The best thing I can say is I don't know. Let's look into it. But that was a great question. And yes, there have been examples to really answer your question. There have been situations where folks get medications that are administered in a specific way covered under Part B through the a durable medical equipment section of it. So that's a great question. I'm glad you asked that. And you're definitely putting in your due diligence, putting in the work, so we can kind of complete that puzzle together and collectively. I think I could end that. So I think I went through most of the questions. I do beg your pardon if I missed one or two in the chat. Let's see.
Can you go back to the resource slide, which is the second or third one before the end of your slideshow?
Yeah, let me see if I can find it.
It had email, yeah, websites and phone numbers.
Yeah. And by the way, all those emails and websites, that helpful little tool is going to be sent out to everybody. Let me just see if I can do this.
Do we have to read this fat book that Medicare sends out?
You can, if you have a lot of time on your hand
No.
and like to read lawyer-like jargon.
It's
but
all Greek to me.
Me too. But what I would encourage is this Medicare consumer guide I'll be sending y'all. It extracts everything, all of the Northern California stuff, and just focuses on Santa Clara County. So I wouldn't really fool around too much with that.
Yeah.
You can check out our Medicare consumer guide. One thing that I order from the Center for Medicare and Medicaid Services is I order the Medicare and You booklet on disc, so I can certainly mail you it's like a CD-ROM disc where it just reads it to you. The voice isn't that great; it might drive you bananas, but they do have that. But no, don't bother sifting through that. You can just go ahead and take a look at our Medicare's
crazy.
consumer guide. Yeah,
It's too big.
I know. It's very
Roy-
intimidating.
Roy, you have another question?
Yes, please. How do the PPOs fit into the Medigap HMO different models?
Well, it's all just like, there must be somebody who's playing with numbers, some actuary somewhere who is playing around with that and figuring out, who they can offer these benefits to, how much it's going to cost, what are they going to charge for these premiums. But I mean, again, they're not so I don't think they create that much revenue for these Medicare Advantage plans, so they don't really offer them. But there are a few, and I do see this question in from Rose. I mean, to make sure I answer this correctly, what I'd much rather do, Rose, is I'll put in a little bit of research to confirm this. It's about PPO, Medicare Advantage plans, where we can and cannot go. And along with the slide deck consumer guide, I'm going to answer this question because this is important. And I should definitely sharpen up my skills before I answer that accurately. So if that's okay, Rose, you'll be getting an answer for that. I want to make sure I answer it properly, just to make sure, because the more I think about it, the more I'm not confident in my earlier response. So I'll go ahead and get that answer to you today. Thank you.
Is the PPO a Medigap plan or a Medicare Advantage plan?
So the PPOs are offered in the Medicare Advantage model. So the Part C plan, they're sold by private insurance companies as well. Great question, Rose, and great question to somebody who asked that of me earlier. Yeah, I'm not too confident in my response, so let me get an accurate one or better one. Just make sure I'm clear. And I would just like to thank you for While we're waiting for maybe other questions to pop in, I would like to thank you for all of your engagement. I like when I hear other voices like you, Roy, and Adrian, and I can't remember who else voiced their question. But I hope y'all learned something new. And, the nice thing is that we have a little bit of time in this open enrollment. Closes December 7. So, please give us a call if you'd like us to check something out for you. If you have a detailed question, you want us to sit and maybe do a plan comparison, whether it be Part D or Medicare Advantage. You want us to answer some Medigap questions, how to get back to original Medicare. If you're new to Medicare, give me a call. The comment here is, aren't all Medicare Advantage plans private? The answer is yes, they are. All of those are sold by private insurance companies, just like the standalone Part D drug plans, just like the Medigap or supplemental plans are all sold by private insurance companies. But the Medigap plans are kind of standardized as far as what they cover with respect to our out-of-pocket costs. But yeah, they're all sold by private insurance companies, yes.
Jean, you have your hand up again?
Yes. Do each of the counties create a guide like you're going to send us?
I hope so. I know there are some really impressive counties around here that are on top of things that actually we look up to. But I mean, they all really should, in my opinion. If they do, I don't know, but I believe this is just, for us here in this county, this is a must-have tool for us. It makes our objective a whole lot easier. And it's a good resource to give to folks, because, but I'm going to guess yes, for sure, but I really don't know. I know a lot of counties do produce that. Some even put it on their website, which is very nice. Soon enough, we'll be having it up on our website as well for all to access. Or you could always call me and I can send it out.
I think you said that one of those, on that resource slide that I was hoping to see again, I think you said there was a number you could call there that would redirect you to your county.
Oh, and you know what? I just realized I didn't share my screen again. So here's one resource slide. And if you wanted this one, so here is a resource for high caps across the state.
Oh, which one is that? Is that the phone number or that's the mysourcewise.com?
So if you want to talk to high cap in Santa Clara County, these first two bullet points are how you get a hold of me and my colleagues. If you want to talk, one more time.
I just saw other counties, call 800-434-0222.
Yeah, and just so you know, the way that is set up is it will automatically route you based on the zip code you're calling from. So all day long, I have people calling from a different county, but they have a 408 zip code or 669 zip code, and it routes to me. When folks get a hold of me and they need to go to get a hold of San Mateo County or San Francisco County, I just look it up and find it for them. But yeah, that 800 number will automatically route folks based on your area code of your telephone number. And then, yeah, for the statewide, I don't have a phone number, but I have a website for y'all.
Okay, thanks.
We have a couple more questions. You said your organization is a nonprofit. So do you charge for your service? And that is you.
So no, yeah, the
not,
answer
yeah.
is absolutely not. So our organization is not for profit. High cap, we don't charge a thing. High caps across the state, SHIP offices across the nation, they don't charge you anything. It's absolutely free. And the nice thing is that it's objective. So we're not trying to sell you any stuff. Unlike certain, just be mindful. I have nothing against sales agents, but certain sales agents, they may represent only specific companies. I'm pretty confident that they want to make money off these interactions and earn commission. That is their livelihood. So they may not be giving us every single option. Some I'm sure that they are, but just be mindful of these things. So I encourage folks, get a hold of your high cap office. then by all means, feel free to reach out to an insurance agent if there's specific products you know you want. I would just do my best to not start there, is what I would do. But yeah, our office is, the organization I work with is private nonprofit, been so since the inception of us in 1973.
Mary Jo asks, do you have Medi-Cal experts in your office?
So we have Medicare experts. So our scope of work isn't Medi-Cal only. When folks call me, they have Medi-Cal questions. I mean, I answer them in general, but I don't get caught up in too much of the weeds of that. I simply defer to the local county Medi-Cal office. Now, when somebody is Medi-Cal, Medicare, no doubt about it, we help because there's a lot of coordination between the state, i.e. Medi-Cal, and Medicare, the federal government. So yeah, we counsel folks that are on both, but not necessarily Medi-Cal only. It's just not in the scope of our work and our grant monies by the state and the federal government. So great question. But we do have Medicare, Medi-Cal experts, no doubt about it. People that are well-versed in dual eligible folks or Medi folks. All right, well, I tell you what, I'm excited about all the good questioning, the good engagement, and just as a friendly reminder, the slide deck y'all see above, I'm gonna send out to you all of the links that you see. You could actually click these links in the file I'm gonna give. All of the phone numbers are there. Our 2022 Medicare Consumer Guide is gonna be in there. And I'll be sure and answer that Medicare Advantage PPO question. I've already got it copied here. Let me just copy it again and somewhere else. So I'll make sure I get all that info to you. Any questions, don't hesitate and reach out to us. These things can be rather scary. I don't want anybody to deal with this on their own. So we are here to listen and here to help. Someone's asking, Medi-Cal has been extended because of COVID. When will it end? Well, here's what I do know about the Medi-Cal, quote, extension. They're not really looking at your income really anymore. They're not really looking at your assets anymore. So for folks that were eligible for Medi-Cal once upon a time, and maybe their income has increased, they're not monitoring those resources quite yet. So they're not just kicking people off Medi-Cal due to COVID. I don't know when it's going to end. I've heard of June 30 of next year, but I'm not certain. We really don't know. There's always a lot of change going on with Medi-Cal. As a matter of fact, there's set to be some major changes for the structure in Medi-Cal with respect to how much assets we may have. So briefly, Medi-Cal is based on income. You're eligible based on your income and assets. Medicare based on your age, right? Or, Medicare, there are certain disabilities. If you're younger than 65, you're eligible for Medicare. End-stage renal disease, kidney failure, Lou Gehrig's disease. Those things, regardless of age, you'll immediately be eligible for Medicare. There are some ailments where we have to wait 24 months before you'll be Medicare eligible. But Medi-Cal is primarily based on income we're getting and assets. Next year, what we are hearing is that the asset levels are going to go up and they're going to go way up. And I'll leave it at that. That's all I know at the moment about Medi-Cal. The rest is speculation. Great question. Okay, let me see. How many people do we still have here? We still got folks here. Well, again, everybody, I'd like to thank you all for joining me here today. We're going to be doing these open enrollment period presentations, not just from me. There will be other folks doing these presentations. Thanks for taking time out of your afternoon to listen to me carry on about Medicare. By all means, if you want to see additional ones, you can go to mysourcewise.com. Check out our event calendar. We got a bunch of Medicare presentations going on. Sometimes it's helpful to hear them in other words, no doubt about it. I know it's helpful for me. So maybe we will cross paths again in the future. Adrian, looking forward to your phone call, my brother. Other than that, everybody, Enjoy the upcoming weekend. And thank you again for being very patient with me and my hardware issues. I've been doing these Zoom sessions since COVID, and people usually laugh when I say, you know, oh, I might have problems. Usually I don't. Sometimes I do. So thank you again for being patient with me. I appreciate all of your time, and have a lovely weekend.
Question
Oh,
on these.
Oh,
On
yeah,
these,
yeah.
there's lots of advertisement and they may fall in the area of fraud, but they're talking about additional Medicare benefits like transportation and food and extra vision and dental that we normally thought would be, you know, an additional premium. What's the deal there? Or you get money back on your Social Security. What plans actually have that, or is that just another form of fraud?
Well, hold on. So the Medicare Advantage plans, they are allowed by law. The federal government allows this. They allow them to add in extra benefits like dental, vision. Some of these Medicare Advantage plans, they include it. Some of them will say, hey, Steve, if you want a more robust dental plan, pay me an extra 20 bucks or 10 bucks or whatever. And they can do that. It's my choice to sign up for that or not. Over the counter, you know, all of those extra benefits, they can definitely add those to what they offer. At minimum, they must cover what original Medicare covers. That's the way that they kind of have those rules written as far as extra benefits. And there was the second part of that question that I know I didn't answer.
Well, they have like sometimes they have like an add-on program, and that's where you got your silver sneakers and your extra benefits for vision, hearing aids and such. But this year it seems like some are adding in transportation and meals and some other stuff. That are all of them supposed to put that in, or again, it's an extra premium?
It's extra.
Especially.
It's all extra. They don't have to do it at all. They're just doing it, I presume, to get your business. You know, no, that's all extra.
But
They
it's an
certainly
extra
can
premium.
do it, but they don't have to.
Yeah.
And yeah, you mentioned something funny. So I heard about this Medicare Advantage plan where if you sign up for us, we will reimburse you your Part B premium, 148 something bucks. I mean, it's beyond me. I mean, I have my opinions on whether I think that should be allowed or not. You know, it seems like, you know, they're buying people to sign up for their Medicare Advantage plan, but apparently it's legal at the moment. And our whole HICAP team and director included, you know, we're not too sure how we feel about that. I mean, you know, it's kind of luring people over, which, I mean, I just wonder if a lot of these Medicare Advantage plans will follow suit. I mean, you know, again, they want to be a part of this market. You know, the longer I learn about Medicare, the more privatized it appears to be going. And, you know, that's kind of frightening to me because it kind of puts limitations on some of us. The beauty of original Medicare is that we have options to go wherever we want, which is the nice thing. But no, yeah, there's all kinds of extra benefits and enticing things that these Medicare Advantage plans are doing to get your business. When folks tell me, you know, I want to sign up for this plan because it has free dental, I go, well, hold on a second. Anybody can buy a standalone dental plan. They're rather affordable nowadays. You don't have to join Medicare Advantage just to get that, especially if you know, need to see all these specialists. If you need to keep this primary care physician or your main doctor, you know, let's think a little bit what we need to focus on. But no, yeah, these Medicare Advantage plans, yeah, they're offering more and more things, and they certainly can. Great question. And
But
are there
sometimes they
any?
don't, the
Yeah.
doctors like dentists and stuff, they will take a group plan like you were employed, but they would not take one of these standalone plans like Delta Dental.
Yep.
They are not, it's for a worker who has a group plan. So these so-called dental benefits really don't do you any good as a Medicare Advantage person.
I mean, hey, that's your opinion. You're allowed to have it. And some people really like it. I mean, yeah, I mean.
Or it's the
I mean,
doctor or a specific doctor, maybe.
No, yeah, I mean, same thing, like your Medicare Advantage plan, you got to stay in that network. You got to stay in the network for the dental. Certain, somebody mentioned that some of these Medicare Advantage plans add on silver sneakers gym membership. You got to go to specific gyms. Yeah, you have to stay within those within those contracted networks. So these insurance companies are contracting with these dental, they're making all these contracts to keep costs down for them, to pass those cost savings, I presume, on to us. But nothing's ever free. We all know that. We're paying for it in one way or the other. Maybe it's the network flexibility, maybe it's the co-pays. I mean, who knows? There's never anything for free. We're paying for it one way or the other. But you all are smart. I don't need to tell you that. And by the way, I'd just like to compliment again everybody joining me here today. A lot of good engagement, excellent questions. And I think we got about 4 minutes left. So now is a good time to add in any last minute questions, comments, concerns. Let me see if I look at the chat over here. I think we're kind of.
We have a few comments. Mabel
see.
says, I believe that payback is for certain states. I don't think it's available in Santa Clara County. For dentists under the Medicare Advantage plans, the dentist must not opt out of Medicare. Otherwise, the dentist is fine to use.
Oh, yeah, that's good to know. I mean, these Medicare Advantage plans, they're literally all over the place. Co-pays, costs, extra benefits. I will be sending you an insert with all of them. By all means, feel free to review all 62 of them. I mean, I can't keep up. I can't keep track of who has what. I mean, they're just changing so quickly for everybody. So, I mean, yeah, let's see if I can jump on this next one. All private plans are in the business of making profits. Coverage may seem to be broad, but they may be very limited with large copays. Very true. Yep. Very true. So, one thing I'll leave y'all with this. I love when I counsel folks where they say, oh, my friend says, join this plan. Join this Medicare Advantage plan. Join this Medigap plan. They're fantastic. They work great for me. My spouse says, join this plan, join that plan. Sometimes it's the worst advice because it does, it may work for them. They're a really good friend, their family, their spouse, but it's just not for the person I'm counseling. Maybe they're on a specific regimen of medications. Maybe they have, some pre-existing conditions. But the best advice that I would tell you is don't listen to your friends or your spouse. Maybe you can say thank you, but it's not one size fits all. People ask me, hey, Steve, which is the best way? Original Medicare or Medicare Advantage? I don't have an answer. Some work fantastic for some folks, and then they'd be terrible for others. So it really is a case-by-case basis, which I know is a cop-out of an answer, and I hate giving it, but it's the honest truth. So if you're ever confused, if you feel something isn't right between an agent or an insurance company, you feel like there may be something missing, reach out, give us a call. We'll be delighted to clarify and give you some unbiased information.
Let's see. Virginia says, I have Advantage plan, or I have an Advantage plan or I've had an Advantage plan for a few years, and I was told that plan takes over Medicare coverage. Is this true?
Yes, it is true.
Okay.
Yep. So the hospital and outpatient, that's all been assigned to your Medicare Advantage plan. That Medicare Advantage plan, they have to manage your care with whatever amount the federal government pays them. And your co-pays or co-insurance or premiums if you have any. But yes, once you sign up for Medicare Advantage plan, you have to 100% utilize that plan's network, medical groups, doctors, etc. And there's the next one. Let me see. Medicare Advantage plans must be equal to or better than Medicare coverage. the plans cannot be less than what Medicare offers. Whoever typed that in, Mabel, that is fantastic. That's exactly the truth. What the federal government did and said is, okay, we'll let private institutions offer these plans. They must cover, they must be equal to or better. I mean, I'm just going to read what Mabel said. Medicare Advantage plans must be equal to or better than Medicare coverage, which is why they're able to add on these extra benefits, but they don't have to because original Medicare doesn't have to. But they have to, at minimum, cover what original Medicare does. Absolutely perfect. Yeah.
Stephen, I think Mabel should present with you next time.
Well, you know what's funny is that I think I don't know why Mabel L looks familiar, and I could almost hear you talking to me, Mabel, with the way that you type. But I'm wondering if we may have crossed paths in the past. But I agree with you, Kat. Mabel, we're always recruiting. I mean, if this is something, no. Well, you know what? I'll use this as a shameless plug. We recruit counselor volunteers all the time. We can't just add you. You have to, there's a whole state certification process y'all have to go to. There's training you get to learn. You get to shadow us doing one-on-one counseling. We get to shadow you. We get to do all kinds of fun stuff. I mean, if solving puzzles and breaking this stuff down is entertaining to your interest, you would interest me. We're always recruiting folks. So we do have a gal at my organization by the name of Angelina, who is in charge of our volunteer recruitment. And we're certainly looking for folks to spread the word in an objective fashion. So definitely reach out. And I think our volunteering opportunities are even built within our mysourcewise.com website. Oh, and Mabel, yeah, so it looks like we did speak over the phone. Okay, that's great. I'm glad that again, you're utilizing our services and you're coming back. So I think that's great. I mean, showing up at one of these presentations, I don't expect you to be a master of Medicare, master of open enrollment. I hope you learn some new things, but every time we learn about this stuff and hear it through routine and repetition, it starts to gel a bit more, puzzles itself together a little bit more clearly. But by all means, feel free to reach out if volunteering with HiCap is something that interests you. All of our other programs, well, not all of them, some of our other SourceWise programs have different volunteering opportunities. So maybe HiCap or Medicare isn't for you, but something else is. By all means, feel free to check us out if you're interested. I'm sure we'd love the help. I know I would. So again, great to be here with you all. And Mabel, maybe we'll cross paths again. Adrian, I'll talk to you again soon, everybody. Thank you again for joining me this afternoon, and I will see you all soon.
Thank you so much,
Kat.
Stephen.
Thank you for inviting us back, Kat. I'm
Yeah.
sure we'll do it again.
Thank you so much for being here. Thank you everyone
Absolutely.
for joining us and being such a great audience. We always have such good audience.
Yeah, you're right. We do. Thank you. Thank you again.
Have a good weekend.